I'm Dr. Lyndon Chang, Medical Director of Hanabusa IVF. The original IVF cycle, this first successful IVF cycle, was interestingly enough a natural IVF cycle. Dr. Steptoe, Dr. Edwards, they had actually tried to do stimulation, but it never worked. So they decided, let's just focus on the egg and fertilizing the egg and creating the embryo and the transfer. And they succeeded with the natural IVF cycle. Unfortunately, it was very hard to reproduce. The Joneses, it was a couple in Virginia, attempted to reproduce the protocol, was unable to. So what they decided to do was go back to the whole stimulated protocol, and then they were successful. After that, for some reason in the United States, everything just kind of followed that path. I guess in some ways, it was a little bit of an easier protocol for most people. And that's where we get into this controlled ovarian hyperstimulation protocol. The idea that we want to stimulate as many eggs as possible and hope that there are good eggs and embryos available. One of the things that we really have to worry about in these hyperstimulation protocols is a term called ovarian hyperstimulation syndrome, or OHSS. In that case, because the hormones are so high, women can get very, very sick from that. The fluid shifts in the body. A woman can be both bloated and at the same time severely dehydrated. This can lead to things like blood clots, strokes. Because of the complications of ovarian hyperstimulation, doctors in Japan from a center called Kato's Ladies Clinic developed a protocol, more of a minimal stimulation. They wanted to try to replicate the success of this hyperstimulation protocol without using all the medications, reduce the complications and even the cost. And this is where a protocol called the Mini IVF protocol. The other thing about a minimal stimulation protocol is the focus on not trying to create so many eggs. You're focusing on more quality than quantity. Because you have you're using less injections, it's obviously less costly. The injections are a very costly part of this process. You get less complications, you get less bloating, you get less pain in your ovaries, the nausea, the headaches. We did a study when I was with New Hope Fertility in New York. With women under the age of 35, there was a 10 to 15% lower chance of success in that case. But when you go into the patients who are older, I would say 40 or older, or patients who have diminished ovarian reserve, mini IVF protocols are definitely better than traditional IVF protocols. Many people think of Hanabusa IVF as a minimal stimulation center. Yes, we're very good at it, but that's not really what we do. It's not like we just do mini IVF across the board. It's really customizing the protocol per patient. I won't know until I go through that patient's history to figure out, am I going to do a high stimulation protocol, a minimal stimulation protocol? Am I going to do natural IVF? Am I going to actually not recommend IVF and do Medicaid time intercourses, or I might even just do a hysteroscopy to clean out the uterus for a patient like that. Most of my patients need minimal stimulation, but really it's about optimizing the protocols for the patient. If you'd like to learn a little bit more and get this in a little bit more orderly fashion, especially more geared to yourself, please contact our front desk team at Hanabusa IVF.